Hi, welcome to The Deepest Cut. Thank you for being here today. It's an honor to have Dr. Hector Villavarga. Did I do that wrong?
You did it great.
Here today, joining us for our episode. Thank you so much for being here.
You're most welcome. Thank you for the invitation.
I wanted to start just to hear a little bit about how you got to Mayo Clinic and decided to be a cardiologist.
That's a long story.
We only have a few minutes. So.
Okay, well, let's keep it short then.
Yes.
Cardiologist goes back to when I was in high school. I finished high school and my mother died.
Oh, God.
So I was ready to go to engineering because that's what my dad was. And I said, no, I want to be a doctor.
Mm-hmm.
So I had to restudy again to present the national exam for the university I wanted to go to. And I did it and I passed, and that's where I went to medical school because originally I'm from Colombia.
And where were you for high school?
I was in Bogota, in Colombia as well,
Okay.
but then we moved to another city.
Okay.
And that's where everything started. And
Got
I
it.
think maybe it was that defined my journey to being a cardiologist.
Mm-hmm.
And to being a cardiologist at the clinic, it's always been nice circumstances and happenings because I met one of my colleagues here. He was giving a talk in Colombia.
Mm-hmm.
So since for the academic part, I'm not that shy, I went up to him and I said, Dr. Miller, I want to go to the Mayo Clinic.
Nice.
And he said, well, you have to take the USMLE exams. And when you get them, let me know. So while I was doing cardiology,
Uh-huh.
I had already trained in internal medicine. I studied for the exams. I passed them. I told him I'm ready. So I came the first time here to the clinic as a fellow in echocardiography in May of 1995.
Like it was yesterday.
Like it was yesterday.
Amazing.
And that's when it started. Then I went back to Colombia. And we started a similar scenario as here at the clinic. Obviously, the clinic there is like a 30th or a 20th of the Mayo, but it was the same philosophy,
Sure.
teamwork.
Sure.
And we got everything up to speed in the echo part, doing new diagnosis, bringing all the technology and all the knowledge that we had gained here. And in 2000, in the 1999 and 2000s, situation was not very good in Colombia.
Mm.
So in agreement with my wife, we said we have to go back.
Mm-hmm.
So in 2001, I came back to the U.S., redid internal medicine.
Wow.
Fortunately, the board took me a year off because of previous studies. So I did it in 2 years. And guess who I met again in a meeting? Dr. Miller.
Amazing.
And he said, I asked him, hey, Buzz, I just want to go back to see what new things you have. And he said, why don't you just come back?
Yeah.
So here I am,
Wow.
20 years later.
Incredible story.
I've been here back
Incredible journey. Couple things. One, what made you so attracted to Mayo Clinic as a young person when you were first taking those exams?
Well, I always looked at the Mayo Clinic proceedings, and when you're in Colombia or in another country, and even in other parts of the U.S., you look at certain institutions like they're far above you, like they're over there in the sky. And I read a lot during medical school, and I always had the proceedings there, but it was just a coincidence of having Dr. Miller there and being in the best institution of the world. I said, well, let's just give it a try if I can go there for a fellowship. And it worked out.
Yeah. Was there any times during that path where things didn't work out? Because you're giving me the good version of the story.
Oh, there's always parts in your life that don't work out, but it's all your attitude, right?
Yes.
So if you say, okay, I have an obstacle here, I have a wall, well, let's climb around the wall, let's climb over the wall. But there's always been issues going around.
Can you give me an example of one of those?
One of the difficulties?
Yeah. That kind of shaped you.
Well, when I came and retrained as
Yeah.
internal medicine, that was tough
That's
because you're
tough.
already a cardiologist.
Sure.
People were telling me at home, you're crazy, you're going back to study. And I
Mhm.
said, I'm just giving a better future for my kids. So
Sure.
retraining, but it's all the attitude. So what I said to myself is, I'll just think it as a pass by. I'll be here for a certain time and then I'm back in my path again.
Hmm.
So it was tough, but not tough because it's the attitude that you put into it.
Right. You'd already kind of mentally prepared.
You're mentally prepared. You say, this is going to be 2 years, then I'm back in my game again.
Yeah. Along the way, did people ever doubt you and tell you you can't do something? You're not going to make it?
That's a great question because normally when people say that, I don't hear that.
Yeah, I knew you were going to say that. I had a feeling you were going to say
I don't hear
one in one ear and out the other.
Yeah, my wife says that when I hear a no, it's for me a yes.
Yeah, I love that.
So even they say, you're going to be this, you're going to be miserable,
Yeah.
you're going to start again. I said, I don't care. I'll just do it again.
Sure. I mean, it's easy to say those things, but to believe those things is different, right?
You have to be a believer.
You have to
Yes.
believe in yourself in
Yes.
order to say something like that, right? Especially when the voices around you are saying the opposite. So where does that strength come from?
I don't know if it's just the resilience that I have. And maybe the great other part is my wife, because
Mhm.
she's been with me for 38 years.
Mhm.
And she's always, we support each other in whatever big decisions we make.
Sure,
And this was a big one that we decided to leave
Yeah.
what we had
definitely.
and restart again. But she says, why don't you hear a no? I said, no. If I hear a no, it's a yes, and I'll pursue until I'm done with it.
And how do you maintain that optimism?
It's just in you. So
Born with it.
Born with it. You say, I try to teach it to my kids to
Yeah.
always have a positive attitude.
Yeah.
Look at the good things. So, for example, my mom died.
Mhm.
It's tough, but how do I look at it? Let's see what comes from it. How should I be from now on? Caring, etc. So you just have it's your switch, internal switch to say, I'm going to be positive, and I'm always optimistic.
Does your job or your work bring you joy?
Oh yeah. I love the work I do, and that's what I teach my kids.
Mhm.
You have to find something that you're happy Monday, happy Friday, every day. Not
For
that
me,
you-
also happy Saturday and Sunday.
Well, yes, but
Yeah.
appreciate that.
Yeah.
But that's the thing, is you have to be happy with what you do. If not, you'll be internally exhausted, saying, oh, not again.
Mhm.
No, I always come with a great attitude
Hmm.
wherever I am. I know I'm going to do positive things. It can be something bad can happen that day, but you look at the positive feedback.
Hmm.
What can I learn from this so this will not happen again?
So, with all of that journey so far, and the strength and the career that you've built, what's next for you?
Right now, probably I built a nice group of research fellows that come here and do
Uh-huh.
research with me. I call them the Latino team, Team Latino. And I'm helping them get into residency here. So
That's great.
they have great projects. So I'm mentoring them. I've mentored over probably 100 research
Wow.
fellows already.
That's amazing.
And they're all over the US or back at their home.
Uh-huh.
And just keeping that same legacy of optimism, honesty, transparency, and always teamwork. I try always to teach them that.
That's great.
That's very important for anything you do. Just when you see your patient, when you do research, when you're in your life, it's those three things.
Yeah. I mean, I can tell that legacy is real. I mean, every time I interact with you, I feel those things, right?
Well, thank
No
you.
matter how difficult the day is, I'm like, you always bring joy. So you've already accomplished all of that. So
We try our best.
yes. Well, thank you so much for your time today and just sharing a little glimpse of your story.
Oh, thank you for the invitation.
Thanks.